Welcome to your contraceptive counseling session. The purpose of our discussion today is to make sure that you know about all your contraceptive options and the possible advantages and disadvantages of each method. After the session today, we hope that you understand your options and feel empowered in your choice of which contraception to use. The three most effective reversible methods of contraception are the three intrauterine devices, or IUDs, and the implant. There are two hormonal IUDs, known as the Mirena and Kyleena. Kyleena contains a lower dose of hormones than the Mirena. The non-hormonal copper IUD is the third type of IUD. The implant is called Implanon. All three of these methods are over 99% effective and are considered the most effective forms of contraception. Let's take a look at each.
Hormonal IUDs are small, T-shaped devices that release progestogen in the uterus. Progestogen is a naturally occurring hormone that's released from your ovaries to regulate your period. Hormonal IUDs are over 99% effective at preventing pregnancy. Hormonal IUDs last for 5 years. They're inserted into your uterus by a clinician. IUDs need to be removed by a clinician as well, but you can have the IUD removed at any time. There are short strings connected to the hormonal IUD that become soft and usually don't cause discomfort to you or your partner during sex. All IUDs are inserted in the same way. First, your doctor will examine you by pressing gently on the outside of your lower abdomen, while at the same time inserting 2 lubricated glove fingers to examine the uterus. Next, they will insert a speculum, like when you have a cervical cancer screening test, and wash your cervix. They will then insert the IUD through the cervix and into the uterus. The insertion of an IUD can cause cramps, but usually it takes less than 5 minutes. You can take ibuprofen or other medications to help with the discomfort. Some women have irregular bleeding after a hormonal IUD is inserted. You may also have some breakthrough bleeding within the first 6 months, but by 6 months, your periods will be much lighter and shorter than usual. Most women only have to use liners for a couple of days when they have a period. A GP or gynecologist can insert the hormonal IUD. For this, you'll need a prescription. The hormonal IUD costs the same as a normal prescription, plus consultation and insertion fees. But there are no ongoing costs once the IUD is inserted until you have it removed.
The copper IUD is a non-hormonal option. It is made from copper and plastic and does not contain any hormones. It is over 99% effective at preventing pregnancy. The non-hormonal IUD is a contraceptive method that is inserted into your uterus by a clinician. You can, however, have it removed at any time. There are short strings connected to the non-hormonal IUD that become soft and usually do not cause any discomfort to either partner during sex. In some women, periods may be heavier or cause more cramps, especially within the first 3 to 6 months after insertion, although this may get better over time. A GP or gynecologist can insert the copper IUD into your uterus, and for this you will need a prescription. The copper IUD is not government subsidised and costs between $100 to $120 plus consultation and insertion fees. Once inserted, there are no ongoing costs until removal.
Implanon is another long-acting reversible form of contraception that contains the hormone progestogen. It is a small rod that is placed in the inner part of your upper arm that slowly releases the hormone into your body over time. You can feel it, but you usually can't see it. It is over 99% effective at preventing pregnancy. Implanon lasts for 3 years. However, you can have it removed at any time. The implant is easily inserted. The clinician will wash your arm, inject some local anesthetic, and then place the implant under your skin. You will need to wear a bandage on your arm for 24 hours. Bleeding patterns with Implanon are difficult to predict. Some women have irregular bleeding for a month, 6 months, a year, or even the entire 3 years. Some women using the implant have no bleeding at all, and some women may have heavy bleeding. A GP can insert Implanon, but you will need a prescription first. Implanon is at the cost of a normal prescription plus consultation and insertion fees. There are no ongoing costs until the time of removal. All three of these methods are over 99% effective and are considered the most effective forms of contraception. Let's take a look at some other effective methods of contraception.
Depo or Depo-Provera is another very effective method. It is an injection of the hormone progesterone and is 94% effective. The Depo injection is given every 3 months. This means you will need to return to your provider on a regular basis to get your injection. Once the injection is given, the hormone cannot be removed. If you wish to become pregnant after receiving a Depo injection, you will need to wait until the hormone has left your body, which may take up to 9 months. While there may be initial irregular bleeding, by 9 months, most women don't get any period. A small percentage of women, less than 10%, will have heavy bleeding. Some weight gain is also a possible effect of the injection. A GP can give the Depo-Provera injection, but you will need a prescription. The injection is at the cost of a normal prescription. You will need to pay for a new prescription every 3 months.
The pill and the vagina ring are effective methods that contain the hormones estrogen and progesterone. Estrogen is another hormone released by the ovaries that works together with progesterone to regulate your period. These methods are 91% effective with typical use. The pill will need to be taken every day and should be taken at the same time to make it effective. Women usually will have regular, lighter and shorter periods with the combined pill. However, as the combined oral contraceptive pill contains estrogen, it may not be suitable for some women, particularly women who smoke and are over 35 years, women who are overweight or have a history of medical conditions such as high blood pressure, blood clots, migraines with aura and some cancers. Some women may experience irregular bleeding, nausea, bloating and/or breast tenderness, but these side effects usually improve by 3 months. You need a prescription from the GP for the pill. Most pills are at the cost of a normal prescription. However, some are on a private prescription and cost more. There are ongoing costs with taking the pill, and you will have to pay the costs of prescriptions on a regular basis.
The vaginal ring is sold as the NuvaRing in Australia. It's a plastic ring that contains the same hormones as a combined pill. You insert it yourself into your vagina, and it needs to be changed every 4 weeks. Most women leave the ring in for 3 weeks and then take it out during the 4th week to have a period. There's no perfect way to insert the ring. You just place it into your vagina to where you can no longer feel it. The ring shouldn't cause any discomfort to you or your partner during sex. NuvaRing provides very good bleeding control. Periods can be lighter, or you can choose to skip them altogether. Some women do report an increase in vaginal discharge with the ring. You will need a prescription to get the NuvaRing. It's more expensive than some other contraceptives as it's available only on a private prescription. You will have regular ongoing private prescription costs.
There are also pills with no estrogen called progesterone-only pills, POPs or mini pills. Some women with medical conditions such as high blood pressure or migraine headaches should avoid estrogen. These pills can also be given to breastfeeding mothers and are 91% effective with typical use. The progesterone-only pill will need to be taken every day and should be taken at the same time to make it effective. If you are 3 or more hours late taking your progesterone-only pill, you must use the backup methods, such as condoms, for 72 hours. Women taking the progesterone-only pill will usually experience a change in their bleeding. Some women will get irregular bleeding, and others may not bleed at all. You will need a prescription from a GP for the progesterone-only pill. It is at the cost of a normal prescription. You will have regular ongoing prescription costs.
Condoms, when used alone, are 82% effective at preventing pregnancy. As you can see, condoms alone are less effective than the previously discussed methods. However, condoms are the only method that protect against sexually transmitted infections. Some women use condoms and another form of contraception together to prevent infections and pregnancy. A new condom must be used each time you have sex, including oral, anal, or vaginal. And there are a few things you should always remember when using a condom. Never use the same condom twice. Always check for an air pocket in the condom's packaging. If you can't squeeze an air pocket, then the condom could be damaged and you should throw it away. Also, look for an expiration date. An expired condom should never be used, just throw it away. Only use a water-based lubricant with latex condoms. Store condoms in a cool, dry place out of direct sunlight. Do not use your teeth to tear the packaging because it may tear the condom itself. You can easily get condoms from any pharmacy and certain supermarkets, and no prescription is required. The ongoing cost is related to how many condoms you require.
Emergency contraception can be used after unprotected sex to decrease the likelihood of pregnancy. Unprotected sex can include situations such as when a condom breaks, you miss your contraceptive pills, or if you are late in getting your Depo-Provera injection. Emergency contraception can take the form of pills that can be purchased directly from the chemist without a prescription or a non-hormonal copper IUD. If you choose to use a copper IUD as emergency contraception, you'll need to see a doctor. Emergency contraceptive pills can be taken up to 4 to 5 days after unprotected sex, although the sooner you take them, the more effective they can be. Emergency contraceptive pills may not be as effective as other forms of contraception and should not be used as a primary method. The copper IUD can be placed up to 5 days after unprotected sex and is 99% effective at preventing pregnancy, but you will need a prescription. You can choose to keep the copper IUD inserted to continue to provide highly effective contraception. The emergency contraceptive pill can be obtained over the counter in the pharmacy and no prescription is required. It is important to ensure that you have regular, ongoing contraception if you have taken emergency contraceptive pills.
And that is a summary of all the contraceptive options available to you. The choice to use contraception is yours. If you would like more information, you can always speak to your doctor, pharmacist, or nurse.